After having a vasectomy, a man should follow some simple steps to have less discomfort after the procedure and also to have better healing after the procedure and to prevent infection from occurring. So in general, after a man has this procedure, he will be asked to put on an athletic supporter that he has bought prior to the procedure. The athletic supporter will be tight and will hold the scrotum so that there's less movement that can lead to soreness and also lead to bleeding. So this athletic supporter should be worn for at least 24 to 48 hours after the procedure at all times. After that, a man can use this or whatever other clothing they want to wear. Also, there's an activity restriction set that we give to men after this procedure. We recommend that they don't do any heavy lifting for several days after the procedure. Initially, in the first day, we recommend that a man go home, put up his feet on the couch, watch some TV, and not do too much walking around or going out and doing any errands. Certainly don't do any heavy lifting for the first 24 to 48 hours. After that, the next day, usually a man will feel more comfortable to get up and walk around and do regular activities during the day, but still avoid heavy lifting or any prolonged exertion. All of this will help with several things, including reducing the chance of bleeding or hematoma formation in the scrotum, and it will also help with reducing swelling, soreness, and a chance for infection. If you're having discomfort after the procedure, we recommend that you can take either Tylenol or ibuprofen. Usually 600 or 800 milligrams of ibuprofen is effective at reducing discomfort and soreness. Sometimes we'll prescribe a pain medication that you can take in addition to that that may help even more. Also, you need to be concerned about infection, so we'll have a recommendation to place a little bit of antibiotic ointment over the small wound that is made during the procedure, and this will reduce the chance of infection at the wound, the procedure site. And but in addition to this, we do recommend that you watch for signs of deeper infection at the area where the tubes were cut. And this can cause redness, it can cause swelling, there can be development of pus or either inside the scrotum or coming out from the wound. So if you have any of these signs or other signs of infection like fever or nausea, you should report that immediately to your doctor who performed the procedure. Now, some men may develop a sore or tender nodule at the location where the end of the vas deferens is. And this can be called a sperm granuloma. This is a rare complication where the sperm coming out of the tube can cause some inflammation. So as a result, this can cause some pain. But generally this is short-lived. Ibuprofen works well for that. But if there's a severe pain or a continuing pain that doesn't seem to get better on its own, then you should follow up with your doctor regarding that, and he can give you additional information about how to treat that. Another issue after vasectomy procedure is when can you have sexual intercourse again? So we usually recommend that a man wait 1 week after vasectomy before having sexual intercourse. After that, maybe another several days, you can begin to have intercourse more regularly. After the procedure, also, we want to make sure that you have become infertile. This does not happen initially after the procedure. So it's important that a man continue to use a different form of birth control, such as condoms, or if his partner is using birth control, that will make sure that you don't have an unwanted pregnancy until it's confirmed that you are now no longer fertile. The way that we do this is that after several ejaculations, approximately 20 ejaculations, we ask a man to bring in a semen sample, and we look for the presence of sperm. We do that again several weeks later, and once 2 specimens have been shown to be free of sperm, then we notify the man that he is no longer fertile and that they don't need to continue using a different form of birth control. So hopefully this information is helpful for you to know how you should take care of yourself after this vasectomy procedure, and also to help you to decide if this is a procedure that's right for you.
Medtwice.com